main question I was answering, Mardik Betanian's question that some statins and hypertension drugs are ACE inhibitors. Do you think some of these drugs may influence the susceptibility of a patient getting the infection? So the answer is that there is, for a very long time, this had been a curiosity, that are the ACE inhibitors or angiotensin receptor blockers helping to block the receptor, and by that mechanism reducing the COVID-19's connectivity to the cells, and so reducing the risk of infection. And there were two schools of thoughts. One school of thought said, yes, when you give angiotensin receptor blocker, the receptor will be blocked, coronavirus cannot attach to that receptor, the risk of infection or the speed of infection would reduce. The other school of thought said that no, when you bind the angiotensin receptor blockers on the angiotensin receptors, that would cause the receptors to be upregulated. That means the cell would produce more receptors to compensate for the blocked receptors, and now we have more receptors to bind with coronavirus. The American Heart Association came out and they said, we are not sure that any one of that works, and I have talked about it in the past. So they said, if you are using ARBs and ACEIs, continue to use it. If you're not using it, do not start it for coronavirus, and everything is fine. This is the study that came out and that showed for the first time that the patients that are using on routine as a routine prescription, if they are using ACE inhibitors and the angiotensin receptor blockers, they have less infection. So if you read here, and I've talked about this before, that is why it is highlighted. ACE inhibitors were associated with a significantly reduced risk of COVID-19 disease, but no increased risk of ICU care. So what they're saying is that because the receptors are blocked and the angiotensin, if it is a ACE inhibitor, that means angiotensin levels are low, that means inflammation is low, then the intensity of the disease, COVID-19, is less. On the other hand, they said that if you have been using ARBs or ACE inhibitors and you have become sick, then the intensity of the, if you have become ICU patient or the intensity has gone up to that level, then once hospitalization is there, once you are hospitalized, then the ICU outcomes are not different from other patients. So in the big early stages, they are helpful. So the short answer is to your question, yes, at least this study shows that ACE inhibitors and ARBs help reduce the risk of COVID-19.